Bismillah, alhamdulillah, wassalatu wassalamu ala rasulillah. Welcome to this episode. We're going to talk about how to improve or strengthen your CV. So, this is applicable to you whether you are a medical student, whether you are a fresh graduate, whether you have been working for some time and you have experience. So, the CV, when you apply for a certain job, so the job of the HR officer or the human resources officer uh, or the selection office is to go through all the CVs and then select the most suitable ones for further levels of selection, like interviews, for example, in materials in this regard. And the range is between 15 and 60 seconds that the officer has to look at your CV and decide whether you are a suitable candidate, and they will consider you for further assessment or interviews for the job. Make your CV easy to read and make the skills and the qualification required by your prospective employer to stand out. So that is, make it clear, simple, uh, uh, unified fonts. Don't use lots of colors. Make it just dark colors. Don't use shiny, light colors. And also put them in order. So if you're applying for a research job and you have done anything about research, whether it's education, training, qualification, or practical skills, bring them on the top. So the idea is you give whatever relevant for the work you're applying for on the top and make it more appealing for the officer and standing out so they could select you for further levels of assessment. Be honest on your claiming. If you claim a skill or ability, be honest about it because it can fail the test of the practice. Strengthen your CV means either you improve how it looks, the editing technique, or you add in more skills and you fill in the gaps and add more sections to it. We have some standard section. Most of the material in this regard will agree on qualification, education, and then work experience and personal information, of course. And the rest of the information or the sections depends whether you have done something about it or not. Of course, personal data should be included in your CV, and most of the material and videos or the courses about CV writing will include personal data, qualification, and work experience. For the other sections, there are a variable opinion about them. Your personal data should include your name, your email address, which is a professional email address, mobile number that's accessible 24 hours, and your address. If it's the work address, then make it detailed. And if it's the home address, unless you're happy with the level of data handling, don't make it very detailed. You can include your country, your county, or state, and then you can include your hometown or city, and then you can include in your email or the cover letter that the um, postal address uh, is available upon request. Education and training or qualifications. This is your university degree. If you have had any postgraduate training, or you have completed training in certain aspects of your practice, then you include it here. Include your training body or the college, the date of graduation or the expected date of completion, and the results if they're outstanding. No need here for a primary or high school education record. The licenses, for example, if you're registered in any medical council or healthcare specialties board, anywhere in the world, you can start with the one which is most relevant to your application. For example, you're applying to the UK, so you include the one from the UK. And you're applying to Ireland, put the one on the top. So the Irish Medical Council on the top. No need for division of registration because different countries call these different names for different registrations. So no need to include them. and then revise chronological order for the rest of your registration if you registered in more than 2 or 3 jurisdictions or medical councils. So the memberships of professional bodies like the colleges of physicians, of surgeons, or the Public Health Association, for example, Australia, or any professional body in local um, where you practice, regional professional body, international professional body. If you're a member of any, say for example, there are some associations, say Pediatric Nephrology, International Pediatric Nephrology Association, or Asian um, Emergency Physicians Association, or whatever it is, you can include them in this section. Relevant work experience and put subheadings. This will come straight after your education and training. It starts from the current role and work backwards. Put them in subheadings, registrar level, SHO or medical officer level internship. Group it with the hospital name, the dates you have completed your internship rotation. Put your supervisor if that's helpful. For example, sometimes you're applying, you have done your internship in the same country, and your supervisor is somebody known or influential. You can include it. Otherwise, there's no need. Regarding the skills and the duties, they're very important, but you can group them as well. So don't write after each role. For example, I worked as a medical officer in X country or X hospital, and then I will write loads of skills and duties, and I will write the same skills and duties again when I say I worked as an SHO in the Y hospital, for example. So group them, duties and skills, as much as possible. Regarding research, audits, and QI projects, they're very important. And all these sections, depending on what the job you're applying for. So some people are applying for education, for teaching, for example, to join the faculty of a college, for example, and somebody applying for research, for MD or PhD. So you move any skills you have that will support your application to the top of your document, and you rearrange your document accordingly. Publications and presentations, they're important, and they're very strong part of your CV, especially in this era of quality improvement, of evidence-based practice. So if you have published any in peer-reviewed journals, of course, they'll go on the top of the list. If you have published abstracts, they also can go up here. If you have done any oral or poster or virtual presentations, depending on your level, then these can be different. For example, if you're applying as for a consultant job, you won't include presenting at grand rounds or something like this, but you would include if there's any workshop, conferences, or professional meetings, like for example, Neurology Association of the country or the region or international body. That's very important to include. But if you're an SHO or applying as a registrar, then these might be relevant. Courses, workshops, include the relevant ones and the most recent ones. If you have done courses in different things, you don't have to include them all. So, for example, the clinical courses, for example, non-invasive ventilation, you could then include the practical ones, the acute advanced cardiac life support, advanced pediatric life support, or trauma life support. For example, these are some of the courses. If you have courses for preparation, for example, of specimens in the lab, if you have courses done in assessing patients on the wards as a nurse, for example, or you have done some courses on radiation protection as a radiographer. So you try to include whatever is relevant and most recent. There are some competencies courses like clinical assessment, history taking, for example, communication with relatives and patients. Then, if you have done any courses or qualifications in quality improvement or patient safety, and also, for example, hand hygiene, waste management, handling patients, um, all these are very important, but don't make the list very big. Then teaching experiences and qualifications. Some people, they have done diplomas and masters or postgraduate certificates in medical education, in clinical teaching. So you can include all that. Include who you have taught or trained, and in what subject and when that was done. So courses, tutorials, bedside training, and also if you're a trainer on some of the skills courses we have already spoken about, so you can include them. And also if you have any formal feedback, you can include it as well if it's available. Leadership and management skills. So this is particularly important now, and everybody should have a good quality of a good leader and can manage the day-to-day task, and also manage the duties and the responsibilities. Awards, medals, distinctions. Include if you have a undergraduate, postgraduate, work-related awards, or national, international bodies award. For example, membership exams, the associations of professional associations of different specialities. You can also include them in your CV. Reference list, you need 2 to 3 supervisors. Put the current one first and try to get a supportive supervisor, and let them know, give them copies of your CV, and let them check it with you and see if they're happy, if they need to make any adjustments. Then included in this list as well, in some specialities, would be websites for organizations, the hospitals you worked for. You have claimed that your hospital 300 bedded. Somebody might go and check, so have the correct information. If you have letters of recommendation, make them available upon request. You can include this line. Further references are available upon request. I'll guide you to my website, learn.mujahid-albadri.com. You'll find videos about different aspects of the clinical practice. And also I have a series on moving to Ireland or working in Ireland as a junior doctor in Arabic. I have a series on quality improvement projects, and that can be also found on my YouTube channel. Learn at mujahid-albadri.com is the email I use for all the queries related to educational materials, and my website. So you can drop me an email and I will be happy to read and respond to you. Thank you for coming this far. Don't forget to subscribe to the channel and leave the comment below if you have any questions, or if there's something you were expecting to hear or watch in this video and you didn't see it. Please write it below and share it with the others.